Let's finish discussing Chapter 56 in the Medical Surgical Nursing, Ignatius and Workman, 8th edition, by talking about mechanical obstruction, hemorrhoids, polyps, and malabsorption. Mechanical obstruction, intestinal obstructions. When we talk about intestinal obstructions, they can be partial or complete and are classified as mechanical or non-mechanical. In mechanical obstructions, the bowel is physically blocked by something, like an adhesion or another part of the colon. Whereas in non-mechanical obstruction or paralytic ileus, peristalsis is what causes the obstruction. It's decreased or absent, and that can be due to a neuromuscular disturbance from any number of different sources. In both types of obstruction, the intestinal contents back up above the area of obstruction, and this is going to result in distension and increased peristalsis as the bowel tries to move. So essentially, the bowel knows that it's having problems. The bowel knows it's blocked, so it increases peristalsis to try and move the contents forward. That's going to increase secretions and lead to additional distension, which could also potentially lead to hypovolemic shock. Just like so many other things in the gastrointestinal tract, obstruction can cause issues with fluid and electrolyte imbalance. Peritonitis is another result. Renal sufficiency or death due to hypovolemia are also possible problems. In this graphic here, we have two types of mechanical obstruction, intussusception and volvulus. We discussed that intussusception is really not all that uncommon in children. Discussing non-mechanical obstructions, a postoperative ileus or a paralytic ileus is most commonly caused when a patient has an abdominal surgery and a surgeon is handling the intestine during that abdominal surgery. So it causes the intestinal function to be lost for a few hours. When someone has an obstruction, we might see hiccups. Hiccups are a common symptom. Pain is very common. Severe pain that abruptly stops is a big warning sign for perforation and should be reported promptly. Other signs and symptoms are nausea, vomiting, fever, tachycardia, hypotension, abdominal pain, abdominal rigidity, change in color of the skin overlying the abdomen, and strangely enough, diarrhea may be present if we have a partial blockage, because essentially, like we discussed, the increase in peristalsis, if the blockage is only partial, the liquidy stuff is what's going to be able to get past that blockage. So with the increase in peristalsis, we're able to push that liquidy stool past the blockage, showing diarrhea. Obstipation, which is no stool passage, is going to be indicative of complete blockage. As far as diagnostics, we're probably going to see abdominal X-ray or CT on these patients. Polyps are possible they can cause obstruction, but often we see these in association with cancers of the intestines. Pedunculated and sessile polyps are what are shown in this diagram. The pedunculated polyps, which are on the right, kind of almost look like a lollipop. These are, an example of these are tubular adenomas. They kind of have that stalk, so like a lollipop or a tree. Sessile polyps are on the left and kind of just look more like a bump. An example of those are villus adenomas, and those have that more broad-based. Generally, these are going to be removed during colonoscopies and biopsies, but they can cause obstruction. Hemorrhoids are distended and or swollen veins of the anal rectal region caused by anything that's going to increase intra-abdominal pressure, like obesity, pregnancy, straining while defecating, and lifting. Internal hemorrhoids can't be seen because they're above the anal sphincter, whereas external hemorrhoids are below the anal sphincter and can be seen on inspection of the anal region. A prolapsed hemorrhoid can become thrombosed or inflamed and bleed, and this is where we're oftentimes going to see the bright red blood on toilet paper when patients wipe. Malabsorption syndrome has a pretty broad definition. It's associated with a lot of different disorders and surgical procedures. Malabsorption syndromes interfere with the ability to absorb nutrients and is often the result of flattening of the mucosa in the small intestine. Bile salt deficiencies lead to malabsorption of fats and fat-soluble vitamins. Enzyme deficiencies result in the inability to break down carbohydrates, like lactase. That's an enzyme deficiency. That's going to be our most common deficiency. Pancreatic enzyme deficiency is also an important enzyme deficiency because this can result in a decrease in vitamin B12. Bacterial overgrowth can cause malabsorption because these bacteria break down bile salts and ingest vitamin B12, so leading to malabsorption of fat and fat-soluble vitamins and leading to B12 deficiency. Chronic diarrhea is going to be a common symptom of patients who have malabsorption syndrome because these unabsorbed nutrients are going to add bulk to the stool as well as fat that has not been absorbed. Other manifestations that we see in patients with malabsorption syndrome are unintentional weight loss, bloating, flatus or gas, decreased libido, easy bruising, anemia, bone pain, and edema. If we did a CBC on patients with malabsorption syndrome, we might see decreased iron absorption or vitamin B12 deficiency, which could both lead to anemia. Cholesterol levels could also, so serum cholesterol levels could also be low due to decreased fat absorption. Our education to patients on malabsorption syndrome is going to be avoidance of substances that aggravate their malabsorption syndrome. So we're also going to want to make sure that they understand about supplementing nutrients. Educating that a low-fat diet is going to be important. Antibiotics might be needed if they have bacterial overgrowth, and antidiarrheals might be used as well. I'm including this graphic on this group of slides just because I really like the visual of where lower GI bleeds can come from. Because we see so many patients with GI bleeds, especially adults. As I've said multiple times, GI bleeds are the leading cause of anemia in adults. And so seeing where those bleeds can come from, I think, is a good piece of information for you.